Aloha class. I will be talking today about reviewing our Hawaii State Board's requirements regarding informed consent first, and then secondly, we'll be comparing and contrasting the content of our informed consent versus the ACA Code of Ethics. First and foremost, for Hawaii, the essential information that providers must explain are A, the patient's condition or diagnosis, B, the nature and purpose of the proposed treatment or procedure, C, anticipated results and benefits, D, recognized material risks and serious complications, and E, alternative treatments, including the risks and benefits of doing nothing. This would include documentation, so a signed consent form. We have something called the reasonable person standard. Hawaii follows a reasonable person standard, meaning the focus is on providing information that a reasonable person would need to make an intelligent decision. In addition to that, we have specifics for opioid therapy. Written consent is required for treating more than 3 months. For mental health, non-emergency mental health treatment requires informed consent from the patient or guardian. And for minors, just informed consent is fundamental for all peoples. So certain minors may have the legal capacity to consent on their own treatment in specific situations. Now moving on to a comparison between the Hawaii requirements versus the ACA Code of Ethics. So for each, I'm gonna just do a versus back and forth. So primary, so for disclosures in Hawaii, for legal medical disclosure, this focuses on material risks and specific legal documentation, whereas the ACA Code of Ethics, it's relational and ethical, focuses on client autonomy, rights, and the counseling process. Treatment details. In Hawaii, it must include description of procedure, anticipated results, and recognized alternatives. For the ACA Code of Ethics, this must include purposes, goals, techniques, and procedures of service. In Hawaii, for risk disclosure, this explicitly requires disclosure of material risks of serious complications or mortality. For the ACA Code of Ethics, requires disclosure of potential risks and benefits, including for non-standard treatments. Moving on to duration and frequency, in Hawaii, this mentions approximate length of care in mental health contexts. For the APA Code of Ethics, it emphasizes that consent is an ongoing process and not just a one-time event. 2 more left. Fees and billing. In Hawaii, general medical laws focuses on treatment. Specific mental health laws require informing of costs. For the ACA Code of Ethics, it explicitly requires detailing fee structure, billing arrangements, and non-payment procedures. And lastly, confidentiality. In Hawaii, mandates informing patients about the limit of confidentiality and mental health, whereas in the ACA Code of Ethics, it has detailed requirements to explain limits, including supervision and third-party involvement. The remaining notes are on therapeutic privilege. Hawaii recognizes a therapeutic privilege exception, allowing providers to withhold certain risk information if full disclosure would be detrimental to the patient's health. The ACA Code of Ethics does not explicitly endorse this and emphasizes a full autonomy and information. Lastly, for cultural and language needs, obviously these are specific to region. These are regionally specific. The ACA Code specifically mandates communicating in developmentally and culturally appropriate ways and providing translators. Hawaii law focuses on medical board standards and documentation of witnesses for communication barriers. And it looks like the one last note here is the ACA Code explicitly requires discussing, this is for technology and social media. The ACA explicitly requires discussing technology use and social media policies. Hawaii statutes generally are silent on these modern counseling-specific boundaries. leaving them up to professional standards. That concludes this review. I know I went a little over. Thank you for the patience. There's just a lot to cover. Thanks for sticking around. See you next time.